The governor is holding a coronavirus press briefing in Santa Fe right now. Let's go there live.
Together. I'm wearing a mask that was provided to me by a collective of mask makers, Viva Vida. I want to thank all of these incredible individuals who are making masks for any number of individuals, both folks who I think can acquire them from this group, and they're donating them as well. So thank you very much. They also have a really interesting way to get it to fit snugly, so I want to give them a shout out for this design, and I want folks to look them up. Viva Vida collective of masks, vivavida.com. All right. So that it's easier to hear me, I'm going to take my mask off. Everyone in the room, again, is well more than 6 feet apart, socially distanced, and no one in this room without a mask or who's not performing a direct service or speaking. And again, we also have a temperature check protocol, and that we do that because we want to utilize and demonstrate that everyone can do their part to make our efforts as safe as possible as we all work together to combat this virus. Okay, let's go to our first slide. I'm going to do the case update first. All right, so today, May 15th, we have 164 new cases today. That brings our positives to 5,662. We have 223 hospitalizations. Both of these numbers are up, and we have a few more people on ventilators. Why do we talk about that? I just remind new viewers, because we have to track our hospital resources. That includes our ICU beds and the equipment and the practitioners necessary, and quite frankly, the medication necessary. It's all of it to make sure that we're giving people the highest quality medical support we can. And we have a limit on what's available there. So it means that we have to really work hard to make sure that we're not spreading the virus. And even if it wasn't about hospital and healthcare capacity, we don't want you to get sick. We don't want you to be hospitalized. We don't want to continue spreading this virus. All right, we have 253 total New Mexicans who have lost their lives to COVID-19. We tragically are announcing today 11 new deaths. And again, I do it every time where I try to remember, because we don't know who these individuals are. We can't come together as a state and mourn with their families, but I can make sure that they know that our condolences are with you. We know this is an incredibly hard time, and it's incredibly painful. These are families that didn't get to be in person to say goodbye. It's completely unfair, and it's a tragedy. It's a tragedy, I apologize, that we can avoid by not spreading this virus. So let's keep working harder together. All right, we've done 124,458 total tests statewide. You can continue to go online and see where we've got our drive-by testing sites. We try to maintain between 40 and 60 sites. Now remember, we shifted from having drive-by sites in every county, several communities, and in larger communities, Santa Fe, Albuquerque, Las Cruces, Hobbs, Carlsbad, as examples. We had multiple sites so that we could see as many people as possible. Now remember, we're now coming to you. So in a week, we were able to test everyone in corrections, and now we've got a plan to keep that up. Know that we're going out to nursing homes aggressively. We will continue to do that. We are testing all workers. So we went from essential workers to all workers. We will come to you. We are working with different communities and different employer groups so that we can be as robust as possible. We are now getting about 5,000 tests, samples collected and run every day, and we have the ability to get to 7,500. Two things have to happen. One, I need you to demand, right, to get in touch with us so that we can get you tested. And two, we need to keep those supplies coming in. That is more difficult, quite frankly, still than it should be, but New Mexico's done really well, and you should expect certainly my effort directly, your congressional delegations' efforts directly and members of your legislature to keep fighting to get the testing supplies to keep coming into New Mexico. All right. Let's talk about the public health order, which is effective tomorrow. Now, I want to go over this a bit in detail again because already it's changed. So I'm going to guess that we're going to get some questions about that, but we think we've made it simpler. And I want to talk about that for a second. So now, all retailers, anybody who's doing goods or services, can do 25% of the fire code capacity. All right, so but when we talked about what we were planning to announce and have in the public health order, and we did that on Wednesday, we said some at 25, we said some at 20. All retailers are at 25% of fire code. Why would there be any differences anyway? Well, larger retailers, we worry if we're following the public health science, and we are, and we're really working on numbers of individuals, even if you're socially distancing, in any location all at once, right? Then you get close to our efforts to try to manage mass gatherings. So we're trying to find those early, productive, safe starts by managing the numbers of people who then support the local retailers. We've determined, based on the science and based on the opportunity and based on the good public health practicing and stricter, right, COVID-safe practices. So that's the balance. Easiest thing, don't go out. Easiest thing, we have stay-home instructions. Easiest thing, don't leave your house. But then if you do, the way that we replace that safety, right, the trade-off is then there have to be more COVID-safe practices out in the communities and in businesses. So thank you to your retailers who are able to do this and are going to be working hard to make sure that they practice everybody in masks and related COVID-safe practices will be in operation. And notice, underlined, must be in place to safely operate. The definition of a retailer, I already did that sells goods directly to the ultimate consumer or end users. Retail spaces do not include wholesalers or suppliers. They also do not include today venues such as movie theaters, concert halls, or amusement parks. That's the same as it was Wednesday. Other non-essential businesses like office spaces, call centers, they also may begin to operate at 25% of their pre-crisis staffing levels. We're working with them directly so they're clear about that information. And employers, to the degree that you can, everywhere, even though we're beginning to ease our restrictions and beginning to learn to live in a COVID-19 world, if you can operate your business by having your workers telecommute, work from home, please continue to do that. To the highest degree possible, state government will continue to lead by example and continue operations in that effort. All right, houses of worship may operate at 25% occupancy. We identified 10, again, duration is a key here, and the numbers of individuals are key here. I want to shout out to our faith-based community who are adhering, I think, to incredibly strict, that's the trade-off, COVID-safe practices, including working to promote, thank you, wearing masks. Everybody in wearing masks, your clergy, your pastors, your leadership, except when speaking, wearing masks, really working hard to eliminate to the highest degree possible that we want to slow the spread of COVID-19. Many, so for members of churches and faith-based organizations, a lot of them are not going to operate. So there are many that are going to wait until we've got safer practices available. I don't know that they're going to wait for a vaccine, but they're going to wait longer. I want to thank you for serving the members of your congregations in different and unique ways, including doing internet services. That's been really incredible, and I want to thank you again. There are also making food boxes and serving their communities and their fellow members of the state in any number of incredible ways. And I want to thank them again for their incredible leadership and participation. So houses of worship can decide how they do services, except for this. They have to maintain COVID-safe practices. They help to design those. Again, shout out to these organizations who are going to help us. And this does not apply still to the Northwestern region. And I know that that's difficult, but we did make changes there. So that they're now in the preparation phase, and we're going to continue to work on some outdoor activities over the next several days to support that community that were already available by the current public health order. Next slide. Okay, so what remains the same? If you are in a high-risk population, 60 years of age or older, if you have chronic conditions, you need to stay home. Any New Mexican who is sick for any reason, do not go out, do not go to work, do not engage in any activities, because these are the individuals who are most at risk of having severe consequences, including death by virtue of COVID-19. It's also the folks who are spreading COVID-19 and related illnesses that we need to do everything in our power to stop. Slight reopenings must not be considered, and they haven't, an invitation to unnecessarily leave your house. The virus risk remains high, and it is living among us. There is nothing in our efforts to ease restrictions that suggests to anyone that we don't believe this virus is a serious worldwide threat, that it remains a public health crisis, and that we believe it is unsafe in general for individuals to not understand that the virus is here, it lives among us, it transfers, there is transmission human to human by just virtually going out. Masks help mitigate. Do-it-yourself homemade masks will not stop the spread. They slow the spread. So valuable, worthwhile, but it is not a be-all end protection. Stay home. All right, congregating in groups continues to be unsafe and prohibited. No large groups. Please do not gather with other individuals as we ease up, because if we aren't successful here, I'll do it at the end. You got to maintain social distancing, at least 6 feet. Look, we're here 18 feet, I'm going to guess. If you've got to go out, maintain social distancing. On my way here to the Capitol, I saw far too much non-social distancing by far too many New Mexicans. And remember, the lives you save can be your own, your families, and remember the risks now that we're identifying for children. Please wear a mask and be socially distant from other individuals. And then high-intensity contact services like dine-in restaurants, indoor malls, salons, and gyms, for the time being, remain closed. So look, today we've got higher number of cases in a variety of counties, including Bernalillo County. Yesterday, cases still too high. We are not yet seeing in New Mexico cases decline. What we're looking for is cases declining, all right? If you don't help us as we ease restrictions, if you aren't really strict about these protocols, we will see cases rise. And as cases rise, what is the only tool that I would have available to stop the spread? You'd have to shut down again. And in fact, states that have reopened quickly, they haven't done it maybe as thoughtfully as we believe we are in New Mexico, are already seeing those spikes, and that's in fact occurring in a neighboring state like Texas. So they've seen in a 3-day period some of their highest death rates yet. We cannot do that in New Mexico. If I can't get New Mexicans to protect vulnerable populations and senior citizens and individuals living in nursing homes and minority communities and children, I will do whatever it takes to protect them. But you can help me. And if you do that, we all do this together, then we can keep easing restrictions, we believe, in a safe public health manner. And we can do this. We can live in a COVID-19 safe world. Next slide. Okay, we're also opening up some additional state parks. I told you by today, I'd tell you where they are or what they are. So Oasis, Oliver Lee, Clayton Lake and Dinosaur Trackways, Pancho Villa, Mesilla Valley Bosque, Living Desert Zoo and Gardens, Coyote Creek, City of Rocks, and Rockhound. Particularly if you live in these communities, we want you to have available safe outdoor activities. We are requiring that you wear a mask when you're outdoors. If you're exercising, right, we understand that can be a very difficult concept, certainly not required, but we hope that if you're getting outside, the weather is beautiful, and you get to visit some incredible state parks, that you do that in as safe a manner as possible. I'm going to remind you quickly what's already been opened. Cimarron Canyon, Ute Lake, Brantley Lake, Sumner Lake, Caballo Lake, Cerrillos Hills, Story Lake, and Villanueva. And again, we're going to keep expanding what's available and open. I need you to help me make those efforts safe, frankly, as safe as possible for the state workers who will be working there and for you and your families. Now, before you go, if you lose this list, again, all online, but you can check EMNRD, so it's emnrd.state.nm.us, SPD for hours of operation. You can also go to nm.gov and you can navigate readily and I think fairly easily to all of these sites to get any information you need. Hours of operation, the days that they're open, visitor capacity guidelines, group size restrictions, and available facilities. And again, I know as much as folks want to kind of, with this relaxing of our restrictions, you want to get out, and it's beautiful. When you move county to county, you create risk. So I want you to think about that. And my recommendation is, to the degree that you can, don't do that. Visit the parks and state parks in your communities to the degree that you can. And if that's just not an available resource for you and unfair to your families, go in small groups, wear masks, practice COVID-safe practices, please. Okay, next slide. All right, we are going to open up our motor vehicle departments. Now, I know that we suspended for a great deal of time, requiring or enforcing New Mexicans to have your license renewed, registrations. We certainly were not going to penalize New Mexicans who did not have access to getting those required in-person services. But in fact, we have to do some of that in person. So here's what we're going to do. By appointment only for services that are not available online. And again, you can go online, MVD, and we're going to want you to do that to make an appointment, mvd.newmexico.gov. We want you to be able to come in by appointment only into these offices and get your MVD services taken care of. Some examples of that are going to be first-time real IDs, services for seniors, driving tests, and vehicle VIN inspections. Employees in these offices will in fact be practicing COVID-safe practices. That means that they will be wearing face coverings, and customers should be wearing face coverings. We will do positive reinforcement for individuals, and we will do it so that it's safe for you to take a photo where you need to do that by keeping our social distancing to the high, at least 6 feet, probably more, as we take these photos and get you on your way. The staff will aggressively disinfect vehicles for driving tests, VIN inspections, and any of the requirements for payment and photos. Even though that's not on this list, expect very, very narrow, practice COVID-safe 19 practices. We're going to do it right and keep this open. Next slide, please. Okay, I know that this has been debated on social media. I would like to remind folks, if you could make that kinder. I know not everyone agrees with this. If you could try to make it practical and not political. These are not political statements. This is about mitigating spread, mitigating risk. We are saving lives. We all have a social contract and responsibility to do that. And I know that it is not popular in a way that I wish that it was. I wish that these behaviors were popular. No individual practices that are good public health practices have been popular by and large in this country. That includes car seats, seat belts, booster seats, and I'm trying to think of the, help me, bags. Airbags. Yep, airbags. I could not think of that. None of that was popular because they take incredible changes. Some of them have a cost impact, but we know, in fact, that they save lives. They were not popular in an enforcement context. And we didn't start as a country to widespread with significant fines until we got those behavior changes. We are not trying to do negative reinforcement for masks. Positive behavior changes is what we're looking for. Everyone, set the example. You can expect this administration to set that example. If you can't make your own mask, go to cv.nmhealth.org, cv.nmhealth.org, and we will get you one. We've had 8,000 requests for masks. They are now, we've got them, and they're on their way to you starting today and through the weekend. Click the red button that says Stop the Spread on that website, request a mask. Again, face coverings keep you safe. Please wear a mask or any face covering. We showed a really easy way to use a bandana. You can use socks, anything. A piece of fabric will work. And it really is the right work. It's compassionate. It protects others. And remember, your essential workers, your healthcare workers, your first responders, your police officers, your firefighters, your grocery store workers, your child care workers. We owe them a great degree of gratitude. Let's show them that gratitude by wearing a mask. Let's protect each other and our families. Next slide. Okay, vulnerable populations and reopening. I've gone over this a little bit, but I'm going to do some specifics. Here's who we are all working to protect, and it's people six. Is this your mask? Yeah. Your slide doesn't say on there. Everyone who's watching it does not say that it's Dr. Scrace's slide. So I will start you off, and then I will give it over to you. Given that states are seeing, quite frankly, incredible transmission in long-term care facilities, we all have an obligation to do a much better job. I know that folks who have been tuning in frequently know that we've got a specific group working on long-term care facility protection, containment, best practices. You know, New Mexico identified a COVID facility. There were some bumps related to that, but now look, that's now a strategy that most states are undertaking. This is a really complicated place because you're confined, contained, everyone living there, high risk. Please help us stop the spread in hospitals, long-term care facilities, child care centers, all the places where we have a high-risk populations. And with that, we're going to go to Dr. Scrace for the rest of that slide and the rest of his modeling update. Thank you. Sorry about that, Dr. Scrace.
That's no problem at all, Governor. Thank you very much. If you could please bring up the slide. I just want to run over this. You can find this on the CDC website. But with all this talk about reopening, I want to make sure that when we say businesses are 25% open, we don't mean that 100% of people should leave their homes and frequent those businesses. And so if you are part of a vulnerable population, phase 1A, you should still stay at home. And also, if you live with someone who is part of a vulnerable population, you need to think really carefully about what happens when you go out of the house and come back, and where you go and come back, because you can bring the virus back into your home and to your loved one as well. So, who is most vulnerable? There's most of it's on the slide, and I've got a couple other groups as well. But right now, CDC says people 65 years and older. The governor already talked about people who live in nursing homes, and that's why we actually closed visitation to nursing homes, I think the first week of all of this, actually. And now The rest of this applies to anybody of any age who has an underlying medical condition, and particularly if it's not well controlled right now. And so those conditions are lung diseases, including COPD, emphysema, moderate or severe asthma. If you have a serious heart condition, you're at higher risk. If you have a weak immune system, because you're on medications or you have a disease that affects the immune system like HIV or rheumatoid arthritis medications. If you have severe obesity, those folks are at a much higher risk as well for real problems if you develop a COVID infection. Diabetes, very common in New Mexico. New Mexico has one of the highest percentages of diabetes in the country. Chronic kidney disease on dialysis, and liver disease. And actually, New Mexico is already number one in liver disease deaths in the United States. So if you have liver disease, you are a high-risk person. There are 4 other groups. I won't go into great detail, but anybody with a disability is likely to be at higher risk for complications of COVID infection. Pregnant women also at higher risk. Any person experiencing homelessness at a higher risk, and we've seen this across the country and the world, much, much higher rates of infection in homeless shelters and congregate housing for homeless individuals. And then the governor also mentioned racial and ethnic minority groups. We're seeing that across the country as well. Higher attack rate of the virus and higher incidence. The last thing I'll just say is that we did hit one of our gating criteria targets today. Our spread rate is now down to our target today of 1.15, which is great. On the other hand, all of our hub hospital ICU beds are full today. Now, we have extra room that we're going to make, but this is tricky, managing this virus, and we want you to do everything you possibly can to stay healthy and not transmit the disease. So as we're giving up our very most effective intervention, which is having everyone stay at home, we have to do other things to make up for that and make sure that we don't have another outbreak like many states and countries have seen, and that's where wearing your mask and keeping your distance from other people comes in. Thank you.
All right. Thank you, Dr. Scrace. I stole all of his thunder. All right. Now we're going to hear from Secretary of State Maggie Toulouse Oliver, talk about voting options. And thank you very much for joining us, Secretary of State.
Thank you, Madam Governor. I am wearing a homemade mask that I'm going to take off in order to communicate more clearly, but I understand you demonstrated how to make these the other day at your press conference. I saw a video a few weeks ago, and I have a bandana and some hair ties, and I made my own, and it's been working very well and pops right in the wash. So thank you for having me here today, Governor. Thank you for your leadership on this incredibly important issue. And for me, this would normally be a time as we are going into the early voting period here in New Mexico where I'd be extremely excited and talking about everyone should turn out in robust fashion to their early voting location. However, due to the public health crisis, I'm here today to reiterate that it is more important than ever that if you're planning to vote in this primary, and I hope that if you are a registered major party voter, a Democrat, Republican, or Libertarian is a registered major party voter in this state that can participate in the June 2nd primary, that you are planning to vote from home. That if you haven't already applied for your absentee ballot and haven't already gotten that ballot, that you please do apply for that absentee ballot. Please do not go to a polling place unless you absolutely have to. And the reasons for that are much the same reasons that the governor has already talked about here today and in the preceding weeks. Most of our poll officials here in New Mexico, the folks who were actually running the election in your neighborhood community, are folks that are over the age of 60. In fact, 80% of poll workers in New Mexico are over the age of 60. And of course, your friends, your neighbors, folks from your community who have to go to the polls, particularly those who have a disability and need that in-person assistance to cast a ballot. Or perhaps they are somebody who requires language translation services, who maybe somebody who never got their ballot in the mail, somebody who has to do same-day registration that's only available at the county clerk's office or a polling place. Those folks need to go. And what we want to make sure that we do is protect our polling places, our early voting and our in-person polling places, the individuals that go there to vote, as well as the people who are volunteering long days over the next several weeks to make sure that our democracy continues to run here in New Mexico. So again, I encourage every single person to apply online at nmvote.org if you have a current or expired New Mexico driver's license or state ID for your absentee ballot. If you've already done so, you should have either already received your ballot in the mail or should be receiving it any day now. I've gotten a number of questions from individuals, particularly in Santa Fe, that it seems like the Postal Service is moving a little slow here. I personally just received my ballot today in the mail and am planning to vote it tonight and get it back in the mailbox tomorrow so it can be back in the Santa Fe County Clerk's office in time to be counted. So I want to remind folks, the sooner you do that, the sooner you apply, the sooner you'll get your ballot, and the sooner you return it, it will be counted. However, it's important to mention that you have until May 28th, up until May 28th, to request a ballot, either online or on a paper form. For those of you that have been waiting for that paper form to come in the mail, our office did mail out a paper form to every eligible major party registered voter who hadn't already applied as of April 27th. So if that hasn't already arrived in the mail, again, it should be arriving in the mail anytime. Simply fill it out and return it postage free in the mail. You can also return your ballot postage free. If you are a person that has to go to the polls for the reasons that I already mentioned earlier, please be aware that your poll workers will all be wearing N95 masks. They will be maintaining social distancing. They will be asking every voter at the polls to maintain that 6 feet of social distancing. Every surface in the polling location will be disinfected before and after it comes into contact with an individual. You'll be given a pen that's been sanitized or completely unused before you use it to mark your ballot. And again, I want to re-emphasize that you will be asked to wear a mask in every single polling place. And this isn't, again, per se to keep you safe so much as to keep everyone else in that polling location safe, particularly our poll workers, the folks who will be there all day long interacting with every single voter that comes in and out of that polling place, and the other individuals that find themselves in need of physically going to vote early or on election day in person. When you go to a polling place, everything else will mostly be the same. But again, we really want to encourage folks, if you don't personally have a mask, of course, the governor has already mentioned a way that you can get a mask for free by contacting the health department, the website that she referred to earlier here in the press conference. But a mask will also be provided to you at a polling place should you arrive without one. And I encourage you, please take and use that mask, not only for your own safety, but for the safety of everybody else around you. Again, we want as few people to go to the polls as possible to keep everybody safe. And we have really seen a tremendous response to voting absentee for this primary election. As of today, almost 130,000, and we may already be at that 130,000 point voters have already applied for their absentee ballot. As I said, they are out in the mail as we speak. If you haven't already gotten it, you'll be getting it in the next day or so. And just like there are multiple ways to apply for that absentee ballot, paper or online, I want to remind voters that there's also multiple ways to return your ballot. Of course, you can put it back in the mail, postage free, to be delivered back to your county clerk's office. However, if you are a person who is listening to this and you don't apply for your ballot quickly and you don't receive it quickly and you do get that ballot in the waning days of the election, we want to encourage you to drop that ballot off at a polling location or at your clerk's office, because ballots can only be counted if they're received by your county clerk by 7 o'clock on election day, either in person, dropped off, or through the mail. And so we just really want to emphasize that the quicker you can apply for that ballot, the quicker you get it, the quicker you mark it and return it, the better and safer for every voter. That's the best way to protect your health and the health of the community during this primary election. Most importantly, I just want to remind everybody, if you have any questions about voting, about absentee or in-person voting, visit the nmvote.org website. Not only can you apply for your absentee ballot there, you can also track the status of your ballot. When you log into My Voter Information, into the voter information portal, there is a link on the left-hand side that says Absentee Ballot Tracker and Status. When you click on that link, you'll see whether or not your application's been accepted, whether or not your ballot's been mailed to you, and then whether or not it has been received back by the county clerk. Please check that. Please feel free to call your county clerk. Their numbers for every 33 county clerk's offices are listed on that website as well. And please feel free to call our office at 827-3600 as well if you have any questions about voting or the primary election June 2nd. Thank you again, Madam Governor, for this opportunity and for your leadership. And thank you to all of the voters in New Mexico for voting from home and keeping every one of us safe.
All right. Well, I can right back at you. I requested my absentee ballot and don't have it yet, but I'm looking forward to it. I think exactly it's going to get to me in the next couple of days. And my mom has requested in Albuquerque her absentee ballot. Voting is really important to her. And we will... I'm sure she will debate me on who she's selecting. We'll do that we'll do that via FaceTime, because as everyone knows, it's the only way I can see her, or outside through a window. And I'm grateful that I get to do both of those things. And I know how hard it is on members of residents of long-term care communities and facilities and their families, and which is why long-term having a safe vaccine and a treatment protocol is really imperative. And while everyone in this country and every New Mexican works towards that, prays for that, in the meantime, we'll have some fun doing that. And I also want to thank the Secretary of State for her leadership. These COVID-safe practices are imperative, critical, will in fact diminish spread, keep people safe, and I'm really grateful for that. I think that we've seen some really terrible lessons and tragedies as a result of in-person voting. So if at all possible, please don't do that. Thank you for making sure, Secretary of State, that everyone's privilege to vote is maintained to the highest level in this state. We're doing that, and that we're also making sure that COVID-safe practices are in place. So I appreciate that. All right, right before we go to questions, I know we've got a slide. I'm hoping that this will be taken by New Mexicans in the vein that it is intended. I receive masks every week. I don't ask for them, but it is an incredible kindness. And each design is a little different. They're all homemade. Some have incredible New Mexico symbolism on that, including we're getting a lot of requests for the state flag masks. They're amazing. And I'm really grateful. And I wear them. And I wear them every time I'm out. And require, even before we required masks, that everyone in the administration, everyone in my family, that they participate in helping keep others safe, including children in our family. Everyone's wearing masks. But given the incredible creativity and the solidarity in this state, we think that we ought to, and so we are, New Mexico Mask Madness. I'll tell you that the Secretary of State said since March Madness didn't occur, that Mask Madness is an effective way to keep moving forward. So it is like March Madness. We want New Mexicans to compete for creative face coverings. So here's how you'll do that. You'll submit a photo of your face mask or face covering at cv.nmhealth.org/mask-madness. If you get to cvhealth.org, you can navigate there. Submissions will be open through Sunday, May 24th, so there's not a lot of time to engage. And New Mexicans will be able to start voting on Tuesday, May 26th. Now, the top vote getters will be seated into brackets and then voted on until a champion is crowned. I am sure there's going to be a question about what is the prize. I don't know what the prize is, but it'll be something amazing, and I am sure any number of New Mexicans as individuals or businesses can help me to think about the appropriate prize or prizes for folks who are participating and crowned the champion of the New Mexico Mask Madness competition. I do think highlighting the things that people can do and the best of us is another way to positively engage our communities to slow and stop the spread of COVID-19. So thank everyone for being here, and we'll go to questions, Nora.
Thank you, Governor. First, we're going to go to Megan Abundis with KOB. Megan, you're unmuted. Go ahead and ask your question.
Hi, can you hear me okay?
Yep, go ahead, Megan.
My question is about the restaurant industry. We have a couple of people who have outdoor seating areas, and they are wondering why that might be a restriction. Is there any possibility for setting up tables outside? Another question, if I may include another one, is has to do with PPP loans, a disconnect. We have heard about certain employees who have now received their PPP loans but cannot open up because of the public health order, but they are on a timeline within 14 days to pay their employees, but they still cannot open up. Can we start with those?
Sure. So restaurants, as we've been talking about, pose, given the models for social distancing, duration, and the fact that you can't wear a mask while you're eating, creates a higher risk. So again, we've had a couple of days, including today, where our numbers are high, too high. And while we're hopeful that that is an indication of, every time we talk about easing restrictions, we do see an uptick in the number of positive cases. The trick is to make sure that we flatten that. So this is a slow and safe effort. And I know that folks that feel like that somehow if you're outside, that maybe this virus disperses differently. I think there can be a scientific effort related to that closed spaces, that having air systems that are closed create issues, air conditioning as an example. But there are still droplets outside, right? They're airborne, they move, right? In the wind, they're moving. It is not safe. You could make an argument potentially that it's a little bit safer outside, but not safe enough. And we need another 2 weeks of data to make sure that we're moving in the right direction. And it's tough. These decisions, it's much tougher opening than it is not opening, right? Because we really have to think about these COVID-safe practices and get ready. A couple of things to the restaurant owners and businesses. We're aware of many of the financial hardships, not just here, but in every business. And New Mexico is working. I'm going to work to make sure that the CARES Act money that we've received, I'm going to work with the legislature to come up with a restaurant and tourism industry, entertainment industry relief package for exactly the reasons that you described in the PPP program. Because if we don't, those industries and businesses that have to wait longer are in the most negative, most concerning financial situation. I think that we can mitigate those financial consequences and concerns. It's not going to be enough for every small business that's been affected. There's no one that I know anywhere in the world who is not upset about the economic implications and impacts here. I am too. It's devastating. But where we can mitigate that by having an economic response, we are, and we're working with the restaurant industry and many individual owners to do that. And of course, they're represented on the Recovery Council, and they're represented in any number of groups within the cabinet to make sure that we get this right. The second thing, the PPP, for folks who aren't familiar with that, is the Paycheck Protection Program that was part of the very first stimulus passed by Congress. Good news is it's getting basically forgivable loans to businesses that keep their employees on. Some of the disconnect is that whether those employees have to be engaged at work in exactly the same way that they were, they don't. And we know that folks are getting really nervous. And we also know that we can work with both those lenders and with Congress as they continue to do investment packages to make sure that those investments are still forgivable as we work to open.
It's
because we're not going to be fully
shocked
open,
after this.
right? There's the preparation phase that the Northwest County is still in. The rest of the state is now in preparation, in phase 1A. We hope to announce in June, the first part of June, that we would be in phase 1B, which could include, at some lower capacity, dine-in restaurants as an example. And then we have phase 2 and phase 3. So we have a long way to go. So this time frame is being too narrowly applied, and we will work to get clarification out, and we will be advocates for those businesses who are concerned. Next question.
Thank you, Governor. Next, we'll go to Dan Boyd with the Albuquerque Journal. Dan, you're unmuted. Go ahead and ask your question.
Yeah, good afternoon, Governor. Thanks for the opportunity, as always. Republican Party announced today that they plan to file a lawsuit about some of the actions you've been taking in response to the pandemic. Don't have a lot of details, but wanted to see if you could respond to that and if you think you're on sound legal footing in some of the steps you've taken.
So I'm going to do the last part, Dan, of your question first. I mean, I am very clear, and I believe in all three separate and equal branches of government. So the judiciary is an important tool in our democracy, and if folks think that we are wrong or are misinterpreting any of our abilities in a public health crisis, they should absolutely bring that challenge, and a fact finder, a court of law, should make those decisions. And many groups and organizations have. And so far, we have found that we are on very sound legal footing or grounds, and we'll continue to demonstrate that, I think, productively in front of fact finders. And while at some level, it's disappointing, particularly when a political arm, instead of working on best practices, tries to politicize this virus, which has no allegiance to any political party or any political effort. Right? It is blind and equally vicious to all populations and all individuals. But that right exists, and I respect that right, and I also expect that we will prevail. But we'll have to wait and see what the lawsuit says, and we'll have to see what a fact finder says about that. But so far, the fact finders have indicated that we have been on solid legal footing for the decisions we've made to date, because we're thoughtful about that. We look at what our powers are and aren't. We make sure that we're doing things that are in the public safety, public health interest, and we've been consistent about applying that. And New Mexicans should expect that we will continue to behave in that non-political framework moving forward.
Thank you, Governor. Next, I will go to Jeff Proctor with New Mexico in Depth. Jeff, you are unmuted. Go ahead and ask your question.
Look at what our powers are and aren't.
Hi, thank you so much. This question is for the governor. Today's announcement from the Corrections Department says that just one staffer and no inmates among nearly 4,000 total people tested in the state's prisons is positive for the virus. Every other prison system in the nation that has conducted wide-scale testing has found large quantities of COVID-19. To what do you attribute the highly unusual finding of an essentially 0% positive rate? Thank you.
Well, first, I'm going to give you a shout out, Jeff. I mean, you have been, and frankly, it's not just you. So sorry, Jeff, I started and then I'm going to take it all away. The media, particularly the media in New Mexico, have been really engaged in educating the public, in asking us tough questions, in making sure, that we're following through with any number of testing and surveillance strategies. And you are among that group of highly respected professionals who are providing information on a regular basis to New Mexicans. And I'm grateful. I hope that it's a couple of things, right? I mean, we got some good national press that I think New Mexico deserved, that we took swift and immediate actions much sooner than states with only a couple of positive cases on March 11th. In addition, even in corrections, right, we were requiring COVID safe practices. We've been enhancing those. The more we learn, the more those are enhanced, the stricter we are. And frankly, I think getting inmates, which was tough. Not all of them were interested. And that sounds like, well, you've got power over them. We do, but you don't lose every single right, like the right to get health care that exists and the right to safe corrections practices and policies. And so getting them all wanting to make sure that they would get all tested and to the degree that we can enforce, and we are, to the highest degree possible, they have to wear masks. I'm not aware of any other corrections system in the country that did that, and I think that went a long way. And in addition, because we closed down swiftly, it meant that we had lower transmission rates and risks in a number of communities, including, right, in Alamogordo, for example, while it didn't quite get us a zero, we were, even at the base, we got the commander of Holloman to be really clear that contractors and military men and women that were required to travel, when they got back, they had to quarantine. They limited their access to any essential businesses that were open. It was really, really tight. I think that made an incredible difference. And it has, in fact, produced the right kind of results for New Mexico, which lets us ease up. If you were asking me a follow-up question, I'm going to give you another plug. I'm sure it's going to be, do I expect it to stay? It's a high-risk environment. And so we've done and worked with partners like the ACLU and others to make sure where we can do a safe early release for folks who were scheduled. We've done that. You should expect us to keep doing those efforts, to keep looking at COVID safe practices, and to do surveillance testing in that population and other high-risk populations. But that's what I attribute that to. But I don't want anyone listening to think, I'm going to go to Dr. Scrace, that we think that that's not a high-risk environment. Which is why we need New Mexicans to wear masks as an example to make sure that we are mitigating spread. Dr. Scrace.
Yeah, thanks, Governor. I would just add one more thing. You alluded to it, but I want to make it really clear that the very, very early decision to stop in-person visitation, stop the flow of people into the prison, and they immediately set up video visits, kind of like you can do with your doctor, and exactly what we're doing in nursing homes. And so the only way that virus can get in to a closed facility is through another person. And I think the Department of Corrections and the Department of Health have a plan for ongoing testing for staff to make sure that we keep that facility safe.
Thank you, Dr. Scrace. Next question, Nora.
Thank you, Governor. Next, I'm going to go to Brandon Evans with KOAT. Brandon, you're unmuted. Go ahead and ask your question.
Good afternoon, Governor. Good afternoon, Secretaries. My question is about the new rules that take effect tomorrow when it comes to masks. With businesses opening, are people going to be required in that police could write them a ticket, or will police be handing them a mask? When we talk about these graduation ceremonies also happening in the coming days, large groups of people, 15, 20, are they going to be required to wear these masks, and how is this going to be enforced? I mean, I don't know if we have clarification on exactly if there's going to be any kind of penalty they could face.
All right. Well, I really appreciate the question. And you might recall that I took, I think, the wind out of the sails about enforcement last week when I said I was really hesitant. I got asked, are you going to mandate masks? And I talked about the enforcement problems in other states because I said I would keep following the science. That means when my public health experts tell me that that was a premature decision to make last week, I accept that. So now I'm mandating masks. But the lesson that I was able to learn is that enforcing doesn't get you the right results. And so how do you then? How do you make it fair? Here's how I make it fair. If businesses want to stay open, and if we want to graduate to restaurants and related entertainment over the coming weeks and months, you better wear a mask, because if you don't, I know what will happen. We will not maintain a mitigated spread, a safe environment. And the only option left to a policymaker like myself is to restrict public access to things in the aspect of protecting, right, everyone, children, seniors, minority communities, people, inmates, corrections folks, healthcare workers, police officers, firefighters, grocery store workers, child care workers. I mean, it's a pretty broad list of individuals that we are all obligated to protect, period. So I think that that is going to be incredibly meaningful. And retailers and businesses thus far have really worked hard to adopt very clear, so you cannot operate without a COVID safe practice. So whatever that industry specific COVID safe practice is, and it means your employees are wearing masks, you can't operate even though I've eased restrictions. It's not one or the other, it's both. Now, let's also talk about obvious enforcement. No one can go anywhere right now without shirts, right, and shoes. You don't get service. You can't come into a business. Businesses need to set that standard. I have encouraged businesses. Some businesses won't let you come in. I didn't tell them to do that, but businesses like Costco, large chains, know the risks to their employees. They have an obligation to safeguard their employees. If you want your employees to come to work, you've got to create these practices. They won't let you in. Here's what I'm telling businesses. Promote positive behavior, reinforce. If one person doesn't have a mask and won't take a mask that will help you, and I'm asking you to provide when they come in, I'm not going to tell you that we're going to cite you if they come in. I'm going to see if we can't create a sea change of positive behaviors in the state of New Mexico. Last thing about enforcement. If we have businesses who are purposely violating COVID safe practices, who have no one in mask, no employees, who don't ask politely, who don't show positive reinforcement, who don't ask us to help them supply masks. Well, this is a violation of the public health order. That's an enforceable aspect to that business. We're not expecting to have to do that. We're expecting, based on the responses by adopting COVID safe practices, that we're going to do this in a positive, fair, and productive manner. Last thing. Individuals should not expect a police officer to get out of their car and write you a citation. They can, but they don't want to do that. I don't want to use that resource in that way. I would expect them to give you a reminder, a stern reminder to wear your mask. And it's a good idea to have officers have masks, and they will put them, they'll make them available at a safe distance, right? I don't want officers coming into close contact with individuals either unnecessarily. We're clear about keeping the public safe. It's a really important question, and the nuance is hard. I am not going to go out and try to make examples of individuals and cite them. I don't think that that wins the day. I think positive reinforcement wins the day, and we don't have the resources to do it anyway. New Mexicans, please keep each other safe. Next question.
Thank you, Governor. Next, I will go to Algernon Damaso with the Las Cruces Sun News. Algernon, you're unmuted. Go ahead and ask your question.
Thank you, Governor and Secretaries, for this opportunity once again. My question pertains to public schools, which normally would be planning for summer K-5 plus instruction at this time. But right now, it's not at all clear what the classroom spaces are going to look like through the summer or even for the fall. Can you tell us, is the Public Education Department going to be offering schools some detailed guidance on this soon, and what can parents expect to hear?
So the answer is yes, they should expect some detailed guidance soon. The Public Education Department has put together a reopen, which it also applies to our summer programs, and they are not open currently because it's not safe to have that available, and we have a small window of opportunity for the youth programs that we identified will be on a very limited basis available through local bodies of government around the state. Parents, educators, education experts, public health experts, policymakers are all working on those adjustments right now with a focus on, is there a possibility for midsummer, late summer, for any of those activities, educational activities, and what are we going to do about reopening for the fall semester. That work is occurring now, and we expect some guidance shortly. So it's not available yet. It's not available to attend yet. As we talked about last week, or actually last week and this week on Wednesday, children are super vectors. They also can have high-risk consequences, and you know that New Mexico is second in the country for the number of kids that are COVID-19 in our COVID-19 positive population. And so it's an area of extreme risk, and we are going to be with an abundance of caution moving forward. But we're going to utilize experts, and you gave me a chance.
Okay, recapping some of the governor's remarks today, all retailers and houses of worship can now operate beginning tomorrow at 25% of the fire code capacity. Now,
really hard to see so many young people, high school, even mid-school, college, master's programs, and doctoral programs who don't get the traditional recognition and family support in these incredible, time-honored traditions of graduations. It's painful that they miss out on something that the rest of us took for granted when we achieved those milestones. And today I want to applaud and then caution. I saw online any number of photos and video clips from the University of New Mexico's parade graduation. So first, the accolade. Everyone is leaning in, trying to find ways to recognize and highlight all of these young people's and returning adults to college successes. They are successes that need to be celebrated. Nobody wants, because of this crisis and pandemic, to minimize entirely these successes and celebrations. So my hat's off to all of the schools all around the state, all around the country, that have found other ways to celebrate. These parades, I think, are meaningful. I adopted one for a family member birthday where we did a car parade with signs, and we might have too harshly thrown presents out on the lawn, but we found a way to celebrate a family member's birthday. Here's the caution. I saw far too many graduates in the backs of trucks, jumping off the truck in their video clips, so excited to see their classmates and friends and family members, rushing to hug them without masks. They were taking photos. So they forgot about social distancing. They let their excitement overwhelm their good public health practices. Hard thing to manage or control at the university. So keep trying to do a little better. I know it's hard. We have to find better ways with confetti and wave parties, so that we don't get too close to folks, that we're really clear about that social distancing. So I really appreciate your giving me the opportunity to reward and recognize great ideas, but to help us get closer and closer. Don't forget the social distancing. Don't forget your masks. And again, every New Mexican should, where you can, put out a post on social media, call someone, congratulate them for these milestones. It's a really harsh environment, and anything we can do that lets these students know we're with you and we're all incredibly proud of you is important. Thank you.
Thank you, Governor. Next, I will go to Matt Grubbs with New Mexico PBS. Matt, you're unmuted. Go ahead and ask your question.
Hi, thanks again for the opportunity. Just going over the changes, it looks like they've been to further ease restrictions. Anecdotally in this news conference, you've said you didn't see New Mexicans take social distancing seriously on your way over to the Capitol, use face coverings. You've also said you're not seeing cases decline like you wanted. I'm wondering, what data or science have you seen to support the changes you made today?
We met the gating criteria, except for having everyone hired and in place for contact tracing. But making sure that that is something we can measure now is available. And I can see Dr. Scrace not wanting me to steal his thunder, because he's the scientist and the health expert, all right? But our rate of transmission is where we want it to be for a state, 1.15. The number of tests, right, on a rolling 7-day average, we want to be at 5,000. We've done that for the last couple of days, so that's on track. And we said it had to be 3,000. I actually raised that gating criteria. The more we know about the virus, the more surveillance and testing we do, because remember, just under 50%. I think it's, he'll give me the exact 44.6%, right in there, are individuals that were asymptomatic that have COVID-19, right? So you got to do a ton of testing. Otherwise, you can't box the virus in. And so meeting those criteria developed by scientists, that's why we eased the restrictions. And while we know that the impact over a couple of days, which is why we don't use just a daily data point, has to be over a period of time. And I'm sure he's going to tell you about our 7-day doubling time. Those are the data points we will keep using, and I have expressed to viewers that I know what can happen in those data points if people don't take serious the social distancing. So you're right. I'm not seeing that statewide. It needs to happen, or the masks in common use yet. And we know what will happen if you don't. We'll see an increase. We'll miss one of the gating criteria. Then I have to make a tougher decision because, in fact, the science tells me I'm going in the wrong direction. Dr. Scrace.
Yeah, and thank you, Governor. I was just going to add to that the question about what data are we looking at to judge social distancing. We have talked about this before, but working with the CART labs, we get a daily report of mobility among New Mexicans, and we take the average mobility among New Mexicans after we exclude people who travel over 50 miles because we don't want trucks to add into that. But we are seeing a slow and steady increase from the very lowest point, which was Easter, and each week we see a slight increase in mobility. That doesn't necessarily mean people aren't wearing masks or standing 6 feet apart, but it's an indication that, as has been seen in other states, that simply talking out loud about reopening in any way increases mobility, increases people getting out. So we are seeing positive progress, as the governor said, with testing, with spread rates, and we're ramping up for more contact tracing, and we think our delivery system has capacity. But we are seeing more mobility, and we're hoping that that doesn't translate into more cases.
Secretaries, this will be our last question. We'll go to Chris McKee with KRQE. Chris, you're unmuted. Go ahead and ask your question.
Thanks a lot for the opportunity. I wanted to ask along the lines, I think, of what Matt's question was. With the state reopening, I think it has been anecdotally acknowledged, probably going to see more cases. It has been sort of discussed broadly in terms of the modeling of data that we have been able to identify possible peaks here and there over the last few weeks. So I guess I wanted to ask, with all of the reopening happening in mind and that modeling plays a significant factor in these decisions, what is the kind of modeling that we're looking at? Or do you anticipate still staying within the limits of the healthcare system, even with this reopening and this expected surge of people being out there? Thank you.
I really appreciate the question because I think that that's the hard part for all of us to wrap ourselves around, because modeling is sound epidemiological data sets that are utilized to figure out how you make safe public health and productive decisions. And that's what we do. But it's not one data point or one day's worth of data. It's a series of data points and then an agreed upon using public health experts criteria. So it's the 4 criteria, and you hit on one that Dr. Scrace talked about. I didn't hit on it. There are 4. The rate of transmission, right? The amount of testing, whether or not we can adequately contact trace. So when you have 150 cases or more in a day, that is a lot of work, right, to do. It takes 30 people to do effective contact tracing per person identified as a positive case. That's minimally. So in order for us to maintain where we currently are, I need 670 contact tracers, and we are gearing up. We've already begun hiring, but we are not there, right? And hospital capacity. And when I talk about that, and if we need, and he'll correct me, and he should, that it is making sure that you don't overwhelm your healthcare delivery system. So it looks at any number of issues, right? The beds, ICU beds, ventilators, PPE, all of it relates to healthcare delivery system capacity. That's in the 4 gating criteria. The gating criteria, right, changes when we have an increase in cases, increase in transmission rates, increase in prevalence. There's any number of ways to look at that. Increased mobility, increased contact, and all of that then will translate itself into that gating criteria because they look at any number. I mean, the amount of data, I just want to remind New Mexicans, I would actually tell you that Dr. Fauci, probably Ambassador Birx, and Dr. Grace, Dr. Richards, and others can do this data by themselves, but they don't. And we use private laboratories like Descartes whose whole business is doing large data analysis, right? The kind of supercomputer aspects that most of us don't really even understand still exists in the world of trying to get to complicated mathematical equations that allow a policymaker like me to make sound policy, and the national laboratory experts. But again, it's that 4. The amount of testing, hospital capacity, the rate of transmission, and contact tracing, and all of those are impacted by how much of the virus we identify, how many folks are positive, and where they are. And the next several days will be very telling. And while I don't like an increased case number, and we have it today, we're going to look at it over a period of time. And I hope the next time I come to you, our trend lines, our peak and surge information is staying within the ranges we expect it to. Because if we don't, then we have to look at whether the decisions that we've made were timely and safe enough. And the only people who can control that outcome, because the virus is here, we have community spread, it is making its way, are individuals. And if New Mexicans are strict in their adherence to public health practices, masks, wear appropriate, and we talked about gloves. Gloves can be a very complicated thing. So masks, washing your hands all of the time. Wash your hands 20 seconds. Have hand sanitizer, wear a mask, stay home. If New Mexicans do that, we will continue over a period of time to slow the spread of this virus. And slowing its spread and boxing it in are the only ways that we can live in a COVID-19 world until there's a vaccine. So New Mexicans, I know we can do this. We're all in this together. Please keep doing it. Thank you for helping me keep New Mexicans safe. Have a great weekend.